All right, welcome. This afternoon's session is Essential Messages from Essential Workers with Latanya Mathis.
All right. So good afternoon, everybody. And first, I want to start off by thanking you for taking time out of your afternoon to come in and hear this message that I'm going to share with you. And I'd like to thank FIPCO and I'd like to thank Mr. Urquhart for giving me the opportunity to present this message to you. So I'll just introduce myself. You may have seen my bio, but I'll tell you a little bit about me. Again, Latanya Mathis. I am a registered nurse. I've been a nurse for over 25 years. My background clinically is in cardiovascular care, which is my passion. I've also worked as a case manager. I worked in hospice as well. In my current role, I am a clinical quality consultant, and that's more of an administrative role. And in that role, my job is to be able to ensure that the healthcare delivery is meeting the standards as it relates to what's being delivered, as well as the regulatory standards. So that's a little bit about me. And today, as the slide says here, we're going to talk today about, I'm going to provide you with an essential message from some essential workers. So I'm going to be speaking on behalf of my nurse colleagues today to talk about this. So when I was asked to do this presentation, and I kept the title as was suggested, it made me think about the word essential. And we've heard that word in the news over the last year, and we still continue to hear it. Just wonder, what does essential? We have an idea what essential means, but I went ahead and looked it up just to see what other definitions I can get and other adjectives. And some of them were like it came as necessary, extremely important, fundamental, vital. Essential implies belonging to the very nature of a thing and therefore being being incapable of removal without destroying the thing itself or its character. So when we think about that, so the essential worker, and I'm going to talk today again about the essential worker, the nurse. So now I've given you, we talked about being essential and a little bit more about the nurse. Most nurses, as you know, have a sense of compassion, and that's why they went into the profession of nursing. And I don't know how many of you knew this, but nursing, according to a Gallup poll, is one of the most trusted professions. I don't know if you knew that or not, but I'm honored to be a part of a profession that is so trusted. Now, before I go into talking too much more, I do want to take a minute, considering it is Black History Month, and I want to take a minute and I just want to pay tribute to some of our African American nurses in our past. And there are many of them. I'm just going to just talk about a couple of them here. Some of the trailblazers, because they've paved the way for us for where we are today. And I think it's really special for what they did. And even, of course, years ago to bring us to be able to do what it is that we do today as a profession. First one on the list here I have is Harriet Tubman. Most of us, we all know Harriet Tubman for the efforts in life, what she did as it relates to freeing slaves. But in addition to that, she served as a nurse during the American Civil War. And with this, she used her knowledge about her herbal medicine to help treat wounded soldiers. So again, when you think about this, the status that she set for us, she went ahead, she freed some slaves, and then she took care of us as well, some of the soldiers as well. Next, I want to talk about Mary Mahoney. Now, Mary Mahoney, she was an African American nurse, of course, in 1878. She's most known for what she did to raise the standard as it relates to professionalism in nursing. Mary worked in an arena of nursing, what used to be called, some of you may remember this term, some may not, but she worked in the arena of private duty nursing. And private duty nursing is nursing where the nurse would come into the home and pretty much care for you. It's one-on-one nursing where versus being in the hospital where the nurse has multiple patients, but it's one-on-one nursing. It's very patient, of course, one person at a time. And there's another term that I think that has kind of replaced private duty nursing today, but we'll talk about that a little bit later. When I think about the professional standards, we've talked about just within this short period of time, I mentioned that we looking at essential, looking at compassion, and looking at the trust, integrity of a nurse. And we talk about professionalism. What comes to mind to me for nursing is my mother was a physical therapist assistant. And one of the things she used to talk about all the time, and even when I first became a nurse, and at that time, nurses wore the white shoes, white uniforms. But my mother was a stickler on that uniform being pressed and those shoes being white. And we look at how things are when you talk about professionalism, just some of those things that go along with the professionalism. But Mary Mahoney, she raised the standard for us in that area. Next, we have Betty Smith Williams. Now, Betty was known for her need to forge ahead despite those roadblocks that may come. She understood the power that comes when people join forces and work together as a common goal. Now, Betty, she was one of the first Black persons to teach at a higher education institution in California, which says a lot in itself. Again, look at the blocks and the way they're paving this way for us as we stand today. Now, from there, Mary went on to form an organization that is near and dear to my heart. In 1971, she formed the National Black Nurses Association, which I have to say I'm a proud member of. And I had the opportunity to share in Betty's 90th birthday celebration last year at our conference. So this is what we're looking at today. So what she put in place today, the National Black Nurses Association is still going live over 100 chapters. I happen to be the president of the local chapter here in Phoenix, Arizona. So we look at these trailblazers and what they did and how they did what they did to set the stage for us today. I do want to point out again here, as I focused here on the African American nurses, and again, there's many of them. There are many of them that I didn't speak about today. But when we look at nursing today and what these trailblazers have done, I'm going to use the term, the struggle is real. They've done a lot, but we continue to struggle to build this profession, even from the standpoint of our Black and brown and people of color. Now, we have over 500,000 nurses in the US. Let that number sit, 500,000. Only 10% of those nurses are African American. So we've come a long way, but we have a long way to go to be able to, I'd like to see this profession continue to grow with our Black and brown people and people of color. So I'm really honored to be a part of this profession again. And also I pay homage to those who paved the way before us. Now in 2021, we can look at we've heard terms in 2020, we've heard terms such as frontline workers, we heard nurse heroes, and this is what we're seeing now when we look at nurses. And I put this slide here purposely because we're looking at how this is what it looks like in our ICUs and in our hospitals and when the nurses are going to work, having to put on this equipment because we're dealing with a pandemic, something that has come and it has shaken us entirely. I was watching a video the other day and it was about ICU nurses in a hospital here in Phoenix. And as I watched that video, again, COVID has brought us to a point that we can see more behind the scenes of what's going on. Just like that video, when you watch those nurses in those ICU units, whether they have a ratio of patients of one patient to one nurse or one nurse to three patients, they're working harder than they ever have before. They stepped up to do what needs to be done. Now, it's already in them. The skills are set there already, but they have had to pull out a different set of skills to be able to manage what's going on today. And we look at this and one of the things that one of the nurses said in there, we talk about messages here. One of the nurses said, when you look at in the video, they were actually, they showed in the video one of the patients where they decided to take the patient off the ventilator. And the family they had received last rites and gone through that process. And they had them on video. And the nurse's comment was, I always hold the patient's hands when they're dying. You know, that just really, everything that we hear that has happened and listening to that, because one thing that was so special, and I know what I mean by that, because just because someone can't talk to you, they can't respond, doesn't mean they can't hear you and they can't feel you. So when you look at that, when it comes to the compassion, that nurses are, in many cases, risking their own lives each day when they go into the facilities to take care of these folks. Now, we have, these are some of this slide shows what it looks like most commonly in the hospitals. But I want to say here that when we talk about, again, the pandemic has showed us a lot of what it looks like behind the scenes. But just because a nurse is not in there with you when you're sick, it doesn't mean that your life isn't being impacted by a nurse. So the boots on the ground, we call it, are those nurses who touch the patients when you're sick. So you see those more in the hospital. But everywhere nurses are, everywhere nurses serve, it's essential. It's essential where they are. And some of the places we see them, I pointed out here, we have them in the hospitals, nursing homes, dialysis centers, doctor's offices, home health. And when I talked about private duty earlier, I think we see a lot of this. That's where you see the nurses are going into the home again, whether they're going into the home to take care of those patients that have a specific need, medications, but they're caring for them in their homes. We have those nurses that work in the public health areas. So those nurses are more involved in those things that are going on in the community when you see those things coming across there. We have what's called 24-hour nurse line. So what that means is in the middle of the night, if you wake up and you're not feeling well, you can call a nurse. She can triage, answer some questions for you. You give her information and then determine if you need to go to the emergency room or if you need to try something at home. So you know, just the way that nurses function. And again, wherever a nurse is serving, it is essential. And I just want to shout out our nurses that are in education. If it wasn't for them teaching us, teaching our students, helping to grow this profession. So even in education, it's essential. Case managers. I've worked as a case manager before. One of the things you see here is when you leave the hospital, if you've ever been hospitalized, you come home and you get a call from somebody and they say, I'm your nurse case manager. And it's almost like an extension of you being in the hospital, because what that nurse is going to do, she's going to follow you, make sure you have what you need when you get home. And then the big goal is to try to prevent you from having to go back into the hospital again. So making sure you have what you need. And when you talk about administration, we have all that's going on, everything that's happening in the hospitals now, that physical work. But in order to keep track of all that data, the charting, the information that we have for these patients, somebody has to be available to operate these systems. And we need nurses to be putting in information, sitting at the table so that the end users who are nurses, it makes sense to them. Then again, as I mentioned for myself, we need quality to make sure healthcare delivery is meeting the quality and regulatory standards. That's the role I function in. We need nurses at the table when it comes to policies, health policies. The nurses in our community going, and right now we have, I think it's at least 2 African-American RNs who are in Congress. So we need them there at the table when those decisions are made to be able to help address what's going on with us. And the last bullet I show here, I called it returning nurses. And the reason I put that one there is because, and again, this is a focus on the pandemic. Many nurses have retired, have come out of retirement to be able to lend a hand to what's going on right now in this pandemic, whether it be helping with testing or helping with the vaccines. But you know, these are all the roles, like I said, many of the roles, and there are many more. But I wanted to say again, wherever the nurses are, it's essential. Nurses spend countless hours making sure the patients and their families that they care for are taken care of. And when needed, I can think about my days in the clinical setting. You know, we go in, we take care of the patient. If I need to be that beautician, I'm going to comb that hair. From a psychosocial perspective, when there's things going on that these patients come in and they need help, I'm not a social worker, but still as a nurse, I'm helping to address those, getting the social worker involved. And the most common that we've seen lately, we're thinking about with COVID, just again, as I mentioned, nurses being there with those folks in the ICU when the families can't be there. They're there to start that FaceTime, put them on video, get the phone, call the priest, giving last words. So whatever we need to be and whatever we need to do, we try to do it to the best of our ability. You know, there's something, we used to hear the term, it's called burnout, but now is often referred to as compassion fatigue. Now, nursing was not an easy profession before COVID. I'll tell you that. We dealt with short staffing, we dealt with inequitable pay, long hours, and sometimes there were some that didn't respect us. Even though we're the most trusted profession, there's some people who just didn't respect us for the mere fact because they could, or they felt like they could. But today, COVID's come along now and added to that burden. For example, when this whole thing started, we didn't have, it's a lack of personal protective equipment. witnessing death at unprecedented rates. COVID has come and compounded a problem that makes it almost life-threatening for some of our nurses to go to work, but they still do. You know, we talk about, again, compassion fatigue. We have to take care of ourselves as nurses, and we want to be taken care of as well, because, for being trained and the skills that many nurses have to do what they do, if we're not taken care of, we can't give the care that's needed for our patients. So we want to make sure nurses take care of themselves at whatever level of work you do, whatever experience you may have, so that you can try to avoid that compassion fatigue. I just want to go here for a minute and just talk about, we've given some insight on the trailblazers in nursing. We talked about the current state of nursing based on what's happening with COVID. And I just want to say here for a minute and go back to the point, I'm going to look at the future of nursing, because it's important to grow the profession. I'm going to say that again. Now, if you're a nursing student, you're thinking about becoming a nurse, maybe you want to change careers, whatever you want to do in that area, I want to make sure that you know that you've chosen to be part of a great profession, which gives you the flexibility to use your talents in whatever area you choose. It can be maternity, oncology, renal, orthopedics, whatever area you choose, you have those options. But I do want to share with you that if you decide, wherever point you are, attach yourself to an organization such as the National Black Nurses Association, so that you can have folks there who can support you and help you matriculate and give you the support to finish. So I'm going to move on here. And we talked about the nurse and how we serve. Now I want to talk about how to advocate for your best health. Now, I'm going to use the word essential. There's some essential actions that you can take to make sure you have the best health. From a community perspective, we can help. We can help each other. Let's partner with our healthcare teams to ensure health and well-being. It can't just happen with an individual. We have to hold individual and community accountability for maintaining our best health. And again, I'm going to go back to before COVID. And here's my question, as this slide indicates here. Before COVID, COVID came along, it showed us what we already knew. We already knew there was vulnerability as it relates to our healthcare. There's gaps in care. And when you think about it, even before COVID, what goals did you have for your health before we even got put in this situation where COVID shined a light to say, this stuff is real. This is real. So thinking about that, now we do have some challenges. And I understand sometimes we're hindered by getting what we need because of those challenges. And I want to make it clear, I get it. There are some challenges and some things that get in the way. Some of those challenges is access to healthcare, whether it be financial. And we already know, how many times have we heard it, statistically speaking, African Americans have a higher incidence of heart disease, diabetes, high blood pressure, higher rates of death related to COVID, and mental health. That in itself, again, exacerbated with COVID, but it's always there. But as a cultural stigma, African Americans are shy about getting help and reaching out to do what they need to do as it relates to mental health, giving the support they need for mental health. So what can we do better as an individual to help going forward, which will lead to better outcomes for us all? Some of the things we can do, and this slide just speaks to some of those. First of all, take an introspective look at your own health. What is it that you want to do, learn? What picture do you want to paint for your health? We can we can become partners with our healthcare teams. We don't want to sound like a broken record. Like I said, we tell you over and over again, African Americans have the highest incidence of X, Y, and Z. But it's important to hear the message and to get the word. We want to be here with you. So partner with your healthcare teams. It's important that you're here for your family and your communities. Think about this. How about leaving a health legacy for the next generation? How about defeating those obstacles like childhood obesity, substance abuse, and mental health conditions? diabetes, and high blood pressure. Think about your health legacy. Now, as I said earlier, I'm aware, we know that there's some things that get in the way. There are some factors that we can't change just because of the near makeup of our bodies. We can't change genetics, right? We can't change how we're made, how God made our bodies. However, what we can do is says that genetics says, my mom has diabetes, my grandmother had diabetes. Understood. But you at this point, perhaps in your life, you don't have diabetes. So there's some things you can do to continue to keep yourself before beginning that diagnosis of diabetes. So doing those things that will prevent full-blown diabetes. For as far as gender is concerned, some diseases and chronic conditions are related to gender. For example, prostate cancer. You can't change that. Mammogram, that's more common, prostate cancer, of course, in men, mammograms in women. We can't change some of those things. However, what you can do is understand and know what are those tests, annual tests that I need to get, so that preventative tests, right? So I get my testing done so that if that is the case with me, diagnosing early to start treatment early on. So again, we can't change some things. Race, we can't change it. We can't change the skin we're born in. I love being Black. Our age, we can't change our age. It's just going to continue to go down the spectrum. Sometimes, as we age, sometimes we get better with age. Then there's times where things creep up and things come around that are more common as you get older. But just understanding those factors that we cannot change. Now, we may not have absolute control, but there are some things we can do to manage and be aware. Now, what can we manage? And again, I don't want to sound like a broken record, but I do want to say this. With your diet, you can manage what you put in your mouth. And again, I realize awareness, there are some limits on food choices. Maybe you're in a food desert. Maybe you don't have transportation to get fresh fruits and vegetables. However, you can make decisions, which is to make the healthiest choices that you can. Making healthy choices on a budget. For example, if you have the choice between going to McDonald's and getting that Big Mac meal, or maybe you go home and you still have a burger, but perhaps with this burger, I'm going to put some vegetables on the side, something along those lines. And be able to, again, awareness, access the information that will help you to understand what you eat and what you drink and what that is for your body. Now, the substances we put in our body, cigarettes, alcohol, the long-term effects of those, they bring our immune systems down. Activity. How about this? Be active to your potential. Everybody can't get up and go to the gym 5 days a week. Everybody can't walk around the neighborhood for 30 minutes, as the guidelines say, at least 30 minutes of exercise a day. However, do it to your potential. If you're home, you're sitting on the couch watching TV in between commercials, get up and move. Move in place. Do that a couple times a day. But whatever you do, just try to stay active to some sort. Staying mentally active is important as well. Your brain is a muscle. You need to use it or you could lose it. There's things you can do to keep your brain sharp, such as crossword puzzles, reading, Sudoku, playing cards, or putting jigsaw puzzles together. Those are the types of things you can do. Now, the next bullet point I'm going to talk about is sleep. Now, I will tell you, I am a professional napper. I've dubbed myself that topic because I love to nap. Now, sleep, as adults, we should get 7 to 9 hours each night, but your body needs that rest so that it can rejuvenate. It can come back and relax itself so you can have more energy to be able to face whatever tomorrow brings. And with that being said, stress, we can't control what's going on around us. Oftentimes we can't, but what you can control is how you manage the stress in your life. Maintain your support systems. In this time of isolation, many people are dealing with that mental health aspect, the stress. Keeping in touch with your social connections. For example, as we're on this Zoom call today, this has become the key to communicating. Have a Zoom dance party. Meet with your friends for Zoom happy hour. But whatever you do, maintain your social connections. It's mission critical for emotional well-being, especially during this pandemic. Now, the positive effects of focusing on your health as a whole, it can help build a strong immune system, a better state of emotional and physical health, and decrease the death rate. Now, as the essential worker, the nurse, and I think I can speak on behalf of the colleagues that I know personally, we want you to understand your health. And it's important to us that you maintain optimal health. We want you to know that. Again, advocate for yourself and know what's available, what the options are for you. And I have to say here, I know that everybody doesn't have the access to commercial insurance. You may not have certain things available to you, but it's important to understand and find out what you do have available. For example, if you're not able to travel to get to your doctor during these times, you don't have transportation, you can have a telehealth call with your doctor. You can have virtual visits. Going back to the 24-hour nurse line support I mentioned, the Department of Public Health, there's opportunity to go there and find out information that you need. Get nosy about your benefits. If you have benefits, you have things on the back of your card. There's things offered through your benefits, like you have, again, mental health resources. There's an app called Calm. They are providing certain sessions that you can attend to help deal with the mental stress now. You have apps that help to focus on your physical activity. I know some of the Medicare programs have what's called, it used to be, I don't know if it still is today, but silver sneakers, where our seniors have access to gyms to go work out and do those types of things. So again, get nosy about what's available to you. Be an advocate for yourself. There's some things that we can't control. There's some things that are challenging to us, but we have to take on and become advocates for ourselves. Look at situations where there are facilities, healthcare organizations, a doctor's office that may offer paying on a sliding scale, paying according to your income. You may not make a lot of money, but whatever you make, that's how much they'll charge you for that. That's better to get care at that level than having no care at all. And the resources in the community, again, the Black Nurses Association here in Phoenix. We haven't been out much this year because of the pandemic out in the community where the table set up. But know that we have reliable, resourceful information that we share from the American Heart Association, the American Diabetes Association, and looking at that type of information, and some of the partnerships that we have in the community to be able to direct people to get to some of those things. So look at what's available to overcome those barriers. Don't get stuck in the barriers. Be an advocate for yourself. Now, at the current rate of loss that African Americans are experiencing, we're losing our storytellers, our grandmothers, our grandfathers, uncles, aunts, cousins, our extended families. Those are the folks who keep us grounded in who we are and what we have achieved as a people. We have to stop the loss of precious intellectual property. One could say it is essential. And again, I ask you, what health legacy do you want to leave? We leave financial legacies, we leave heirlooms, we leave property. Why not leave a health legacy? Meaning, tell the health story. What is the family history? Despite having a family history of diabetes, you can control via diet and exercise to help decrease your chance of actually getting diabetes. In fact, I would say to you, each action that each one of us takes is essential. And I want to close out with this quote by Michelle Obama. And this applies not just in the health realm, this applies to your life in general. Again, be an advocate for yourself. If you're committed to doing what it takes, anything is possible. It's up to you. Thank you for your time today. And if there's any questions, I'm happy to answer them, or comments.
All right. Thank you, Latanya.
You're quite welcome.
Does anyone have any questions? Look in the chat, or if you want to. I see an applause from Jacqueline.
Thank you.
And Erica and Chiquita.
Thank you.
All right. Great job. Are there male nurses? That's an easy one. Latanya?
That's the question. Are there male
Yes,
nurses?
that's the question.
Oh, absolutely, there are male nurses, and I'll just expound a little bit more on that. At our conference last year and the year before with the National Black Nurses Association, we have what's called a bow tie breakfast, and that bow tie breakfast is led by and a room full of our male nurses. And each year, that's just an example from my experience with the National Black Nurses Association. But yes, there are many male nurses.
Excellent. We have another question here. First, it says, thank you. And do they still have nurses' aides?
Yes, they do. And nurses' aides, you oftentimes will see them under the title of what's called a CNA or a certified nursing assistant. So, well, let me say two things. A CNA is in the hospital, they're certified nurses assistant, certified nursing assistant. And then in some cases, you might have some that work as a nurse's aide that may not be licensed. And perhaps in some other setting, like a group home, you might see them there as well.
This is just me. I'm going to ask you this question. What about candy stripers?
Oh, wow.
It's from back when
So,
I was younger.
and I want to say that candy stripers. I
There was
think
the kids, they were in high school, kids that would kind of wear the pink and white outfits, kind of look like candy canes.
I was gonna say I don't know that I've seen those in a very long time, but what I will say, oftentimes what you see, and I've seen some volunteers from some of our elderly folks that come into the hospital. They might volunteer to bring flowers in that, um, but I haven't seen candy stripers in a long time because I think a lot nowadays, but many of the high schools they have those. I can't think of the term right now, but the programs where they're working towards credits to be, for their programs. So they're actually going to the hospital. So they, I can't think of the term; it's escaping me right
Yes. Well, I think Erica has it. Young medical volunteers.
now. There
We
you
don't
go.
call them candy stripers anymore.
Thank you, Erica.
All right. So we're at 35 minutes. You still have 5 minutes, Latanya. Did you want to give us any more gems of wisdom? You have 5 minutes.
The gems of wisdom that I can offer is, as an individual, we're speaking to this group and basically at a community level now. But the gems that I can offer is to make sure that you take a look at yourself and think about what you want and what you want the rest of your life to look like, in every aspect, whether it be your holistically, because nurses tend to treat holistically. So whether it's your mind, body, and spirit, take a look at your life and ask yourself the question: what picture do you want to see for your life? That would be my comment. And thank all of our nurses who are working as boots on the ground.
Excellent. Well, thank you. And Ernie, you are currently a co-host. If you want to give any ending words, we have a few minutes for you.
First of all, thank you. I just typed out one question. Latanya, I wonder if you have any thoughts or input, guidance about vaccines.
Sure. So as it relates to the vaccine, my first thought is it's a personal preference, of course, and you can decide if you want to get the vaccine. So in many cases, the benefits outweigh the risk. So you have to take a look at yourself and see what what benefit it would be for you and what the risks are, because on either end, at the end of the day, you have to do what's best for you. But I think that if you are in a position that you can get the vaccine, I would say go ahead and get the vaccine.
Right.
Again, I would take it from the perspective of being a person. Obviously, it's a personal preference. And the one thing I will say, I'll add to that, actually, is research and understand for yourself. Take the information, understand it, and make sure you're knowledgeable so that you can make an informed decision.
Well, I want to personally thank you for taking this on. Thank you for your for the history lesson, which was very, very helpful. Thank you for your thoughts about responsibility for self-care, even as we prepare for care by you. And hope it was very, very helpful to everyone. And I just want to say, those of you who participated, thank you. We do not have an immediate feedback form for you, but we will have one available probably after tomorrow. But in the meantime, if you have any feedback regarding this session or others, we invite you to just write a note, email, send it to fibcoadmin, FIBCOADMIN at fibco.org. fibcoadmin@fibco.org. And, whatever feedback you want to give about the session or sessions and what you enjoyed and any other feedback, as well as things that might help us, because FIBCO's intent is to follow these sessions up and this fair with actual other events and activities related to things that we covered. So we appreciate any input. And this session, along with others, will be available for a replay after after tomorrow. So everything is being recorded, and we'll be sending you a note telling you where you or others, if anything that you missed yesterday, today, tomorrow, the whole 12 hours will be available for replay and review at some point. That's all I have. Thank you very much, LaTanya. Thank you for those who joined in. Appreciate you.
You're welcome. And everybody have a good rest of your day and have a good weekend.
All right.
Mhm.